SA Medical Association representing doctors is raising concerns about our capacity to vaccinate our population at the rate required to meet government targets. Dr. Angelique Coetzee is the chair of the SA Medical Association. Dr. Coetzee, good evening to you. Thanks very much indeed for your time. We look at the targets that are set by government. We look at the rate of vaccination. We look at a third wave of the virus, and it doesn't start to look like a pretty picture. It starts to look very worrying.
We are a bit in trouble. Good afternoon, and good afternoon to all your viewers out there, and thanks for asking our opinion. Yes, we are in trouble. It is not a good time to start with your phase 2 rollout, people above the age of 60, simultaneously when we are moving into a third wave. But there's nothing, it is what it is. There's nothing that we can do. We should have started much earlier with the phase 2 rollout for the people above the age of 60. And currently, you know, for people to go into these vaccination sites without a number of, without receiving the SMSs, what we call walk-ins, it might be a bit of a problem because we don't know who has already been infected or not, especially if there's not good ventilation. So we are pleading with people, please make your appointments via the EVDS system. Please wait for your SMS to come. Please do not just go into these sites without being able to make sure that you will be vaccinated within an hour or up to 2 hours at least.
And Dr. Coetzee, I mean, our healthcare system, is it ready for a third wave? I mean, we've learned some lessons. The care of people with COVID-19 here and around the world is much better. I think oxygen supplies apparently are well stocked. But are our hospitals ready?
Well, we are, in the case of the oxygen, so we learned valuable lessons with the liquid oxygen. But I need to say that even in the midst of the second wave, we were only using 4.7 times more liquid oxygen than normally, and we still managed to get enough liquid oxygen. So now they have increased that capacity to 8 times the usual number. The problem will only lie with the oxygen cylinders at primary care level and clinics if those you know, if they don't have a good reporting system, that when those cylinders get empty, they must be refilled, and you cannot just refill it and reuse it. It should go through the company that is responsible for that, because there's the whole cleaning process in that. So please do not use your oxygen cylinder, or don't give it to anyone else. If you have used it, it must be cleaned properly.
We have a big hospital in Joburg, the Charlotte Maclear Hospital. It's still closed, and no one, and we've tried, no one will give us a date for when it will reopen. We have a third wave in Gauteng right now. Surely this is a hugely serious problem.
Well, this is a problem. Sama wrote a letter about a week and a half ago. We're still waiting for any feedback. I must say, unfortunately, the feedback from National Department of Health, provincial departments of health of other provinces are really very, very poor. I'm not sure whether they don't think it's worth their while to meet with us, and whether we will go away if they don't answer us. It is really a problem. It is a huge problem, especially around the patients needing chemotherapy. That's a problem.
Sure. So they don't even want to meet with you, because, I mean, they're not telling anyone anything about this hospital.
Yeah, they don't. It's just the silence, you know. You send this letter, and this silence. The silence is ear deafening. So, you know, it will come down to that we have now to start to phone. You know, I will need to get onto a telephone, call the Deputy Minister, call the MEC of Eastern Cape, call the MEC of KwaZulu-Natal, and please say, please, can we have a meeting with you? Can we sort this? It is not really the right way to do this. You know, we would appreciate if people can come back to us when we ask questions and just not ignore it.
Dr. Coetzee, you chose your words quite carefully. You spoke about the deputy minister, and I mean, we all have different relationships with different people. I need to ask you about the health minister, and I realize you're an apolitical body, so if you want to duck the question, I will let you duck it, okay? But you will, of course, have seen the story around the company Digital Vibes, the company run by the personal assistant of the health minister, Dr. William Kize, the corruption claims. Do you think he needs to stand down, or is that a question between him and the president, and you're going to send me to the union buildings?
I think it should be between him and the president, and then it should lie there. But then also one needs to understand that if you are in a leadership position, what is the right thing to do if there's allegations? I think that's a personal thing that you need to decide for yourself. And looking at what is the right thing. It's always what is the right thing to do.
I appreciate your position, Dr. Angelique Coetzee. Thank you very much indeed. Chair of the SA Medical Association. Well, complex problems in the health department. And of course, we still don't know what's happening at the Charlotte Maclear Hospital. Right.